नमस्कार मित्रों, हम हमारे चैनल पे आपका हार्दिक स्वागत करते हैं और उम्मीद करते हैं कि आप और आपके प्रियजन सुरक्षित और स्वस्थ होंगे। दोस्तों, कोरोना वायरस महामारी के दुष्परिणाम अत्यंत विनाशकारी एवं दुखद रहे हैं, किंतु एक्ट फोर्स के कार्यकर्ता दिन और रात काम कर रहे हैं ताकि हमारे फ्रंटलाइनर्स और वंचित भाई बहनों को हर संभव मदद किया जा सके। रही बात असम और बिहार के बाढ़ से प्रभावित राज्यों में भी हमारे कार्यकर्ता सभी पीड़ित देशवासियों के पुनर्वास के लिए और उन्हें आवश्यक खाद्य आपूर्ति प्रदान करने के लिए एड़ी चोटी कर जोर लगाकर काम कर रहे हैं। हम एक परिवार हैं, भारत के हर कोने में काम करने वाले हजारों लाखों स्वयंसेवकों का, और आपका समर्थन और प्यार ही जो हमें प्रेरित करता है। हम हजारों लोगों की मदद कर चुके हैं, लेकिन अभी भी हजारों और कई लोग बचे हुए हैं। हम आपसे दरखास्त करते हैं कि उनकी सहायता के लिए हमारे ऑनलाइन प्लेटफॉर्म पे आके फाइनेंशियल असिस्टेंट के तौर पर फूड सप्लाईज के रूप में आपका दान एक जिंदगी बचा सकता है। आपका दान करने के लिए आप हमारी वेबसाइट पे जा सकते हैं। एक बार फिर से हम एक ठोस स्तंभ की तरह हमारे सभी नागरिक का धन्यवाद करते हैं। एंटी कोरोना टास्क फोर्स सदैव ही मनुष्यों, जानवरों के लिए काम करता रहेगा। ये स्टेटमेंट नहीं, वादा है। मानवता हमारा धर्म है, सेवा ही साधना है और हमारी पहचान एंटी कोरोना टास्क फोर्स। हम एक्ट फोर्स हैं, हम काम करके दिखाते हैं। दूसरों की खुशी में सफलता निहित है हमारी। जय हिंद, जय भारत।
हेलो, नमस्कार, गुड इवनिंग। मैं राधिका अग्रवाल अपनी को होस्ट रोली वर्मा और एंटी कोरोना टास्क फोर्स की टीम की ओर से आज के वेबिनार में आप सबका स्वागत करती हूँ। पूरे साल कितने सवाल उठे हमारे मन में कोरोना को लेकर, और अभी भी उठ रहे हैं, और अभी भी कितनी खबर आ रही है। वैक्सीन कब आएगी, इसको लेके भी बहुत चर्चा है। बहुत सी जगह वैक्सीन तैयार की जा रही है। जब तक वैक्सीन तैयार होती है तब तक ऐसे ही कितने ट्रीटमेंट रेडी किए जा रहे हैं जिससे सबको सुविधाएं दे सके और सब कोरोना महामारी से लड़ सके। वायरस से लड़ने के लिए हमारे वॉरियर्स फ्रंट पे रहकर काम कर रहे हैं, और जो लोग कोरोना से अफेक्ट होकर उसका दर्द सहकर उस स्थिति से गुजर के आए हैं, वो साथ ही साथ उन लोगों के लिए, ह्यूमैनिटी के लिए प्लाज्मा डोनेट कर सबको लड़ने की हिम्मत दे रहे हैं। ऐसे ही प्राणा पैन इंडिया, जो एक बहुत ही ब्यूटीफुल ऑर्गेनाइजेशन है, इज वर्किंग फॉर मैनकाइंड जस्ट लाइक एंटी कोरोना टास्क फोर्स, एंड वो एक्टिवली वर्क कर रहा है प्लाज्मा डोनेशन के लिए।
Listen to four voices who defeated corona with us. They got infected, treated, and finally recovered. I am glad you are well enough to talk to us today. Let me introduce to you with our guests for the day, Dr. Shrikant V. Dr. Shrikant V is a consultant plastic, reconstructive and cosmetic surgery at Manipal Hospital, Bangalore. Dr. Shrikant is an adjunct professor of plastic surgery at Manipal University, who specializes in microsurgery, hand surgery, peripheral nerve surgery, brachial plexus surgery, cranio-maxillofacial surgery, and cosmetic surgery with a special interest in microsurgery. He has a number of publications in peer-reviewed journals. Dr. Shrikant V is also a member of KMC, Karnataka Medical Council, APSI, Association of Plastic Surgeons of India, ASI, Association of Surgeries of India, ISSH, Indian Society for Surgery of the Hand, and ABSI, Association of Breast Surgeons of India. Dr. Shrikant V has donated plasma 4 times and is also 100th pack for Prana Pan India as his 3rd donation and 50th pack for Bangalore as his 4th donation. He will join us anytime soon. We are waiting for him. My second guest for the day is Bhavesh Bhanushali, Director of Pasiza Foods. He has worked with Pyrotech Fire Protection Services and Pyrotech Consultants as designated partner before joining Pasiza. Bhavesh has donated plasma 6 times. Good evening, Bhavesh. How have you been?
I'm doing good. How are you guys?
Wonderful, wonderful. Thanks for connecting with us in today's webinar. Our third guest for the day is Dr. Lalit Dhantore, a consultant transfusion medicine at Fortis Hospital, Mumbai. His areas of interest are cellular therapies, transplant immunology, and immunohematology, to name a few. Dr. Lalit has donated plasma and 2 platelet units. How have you been, Dr. Lalit? Good evening, Dr. Lalit. How have you been?
Good evening, all.
Good evening. Good evening. How have you been, Dr. Lalit?
Hello.
Hello. Are you able to hear us? How are you doing, sir? I hope there is some technical glitch here because of which Dr. Lalit is unable to hear us. No worries. We will go to our 4th panelist for the day, Kushal PR. Kushal is a program manager, e-commerce foundation, Amazon. Kushal was a French professor with his diligent effort towards accents and intonations, which makes him speak like a native French, with his 17 years of diverse experience in e-commerce, radio, print media, hotels, airlines, call centers, KPOs, and BPOs. Kushal has donated plasma twice. Good evening, Kushal. How have you been?
Hello.
Kushal, I request you to please
Kushal, you have to
your mic.
unmute yourself.
Oh, great.
Good evening, everyone. I'm doing extremely well, and I hope everyone's doing well and safe too.
Wonderful, wonderful to connect with you in today's webinar. Dr. Shrikant, we is live with us. He has just joined in. Good evening, Dr. Shrikant. How have you been?
Am I audible?
Yes.
Good evening. Am I audible?
Yes, sir.
Hello. Yeah.
Yes,
Good evening,
sir.
everybody. Hope
You are
everybody is
audible.
fine. Yeah, this is me. Wait for the audience to know who I am.
Sure. And Dr. Shrikant, we again is a very senior expert and he is acting as a consultant plastic reconstructive cosmetic surgery at Manipal Hospital in Bangalore. He's also working as an adjunct professor and he has a specialization in microsurgery, hand surgery, peripheral nerve surgery, brachial plexus surgery, craniomaxillofacial surgery, and cosmetic surgery with its special interest in microsurgery. He has a number of publications in his name and he's a member of KMC, Karnataka Medical Council, APSI, Association of Plastic Surgeons of India, ASI, Association of Surgeries of India, ISSH, Indian Society for Surgery, Off the Hand and ABSI, Association of Breast Surgeons of India. And he has also donated plasma 4 times and is also 100 bag for Pranab and India, and third donation, which is like 50th bag for Bangalore as his fourth donation. And we are extremely thankful for all our 4 panelists who have joined us today in this webinar. To start off with, Dr. Shrikant, as you being a senior expert and senior doctor in this field, with your vast knowledge pool, could you share with us how are you feeling now, and what was your reaction to hear that you have a coronavirus, and how it actually impacted you, Dr. Shrikant?
Thank you for kindly. And I did have corona some time back. Obviously, there was a gap somewhere in either social distancing, masking, or sanitization. And at that point of time, we're all working only going to work, hospital, and back. And so probably I must have contracted corona there. And fortunately, I did have a very mild infection, and I was fortunate to have a colleague who immediately able to pick it up and quarantine and start off medication. I was in quarantine 17 days because that was what was mandated by our hospital. So I sat at home, watched TV, got bored, and after 28 days we checked my antibody level. It turned out to be, I'm not sure what values everybody uses, but I was told mine was around 29 into 49.2, whatever that number comes to. So I donated the first time. 15 days later, again we checked my antibody levels. It had gone up to 33. So I donated again. And this time we did our serum protein levels because we were a little concerned whether frequent donations would drop the protein level. Nothing happened. And 15 days later, again I came and checked my antibody levels. It jumped. I donated again, and again serum protein levels were perfectly fine. And the last time I donated, my antibody level was 24. So obviously, donating plasma, COVID plasma, does not seem to trouble the immune system, and you can donate as long as the antibody levels are there. And I hope that we are being useful. I know controversy has to be given, not be given, but I don't think anybody has had the last word on COVID plasma yet, because nobody knows enough of the coronavirus and immunology to tell us, yes, this definitely works, no, this definitely doesn't work. And probably in future, with little more clear-cut studies coming out, we will know whether using this plasma will help or not. I'm sure, going by logic and science, I think it should be helping somewhere. And we have seen that our bank officer is very clear on to whom the plasma should go to. They have very strict criteria, and that makes me feel comfortable that the plasma is going to look for some deserving patients.
Wonderful, wonderful. Dr. Shrikant, as you narrated the entire story that you been affected by the coronavirus and suffered from mild symptoms, and once your antibody levels were up to the mark, you decided to donate it to save lives. Was there any sort of an motivation or an inspiration? What made you to go ahead and donate plasma, Dr. Shrikant?
Yeah. Well, donating plasma, I guess, was something I would always do. I've been a regular blood donor since the age of 18. So going by
Awesome.
probably I'm looking the fact that I'm on the other side of 50 now. So I have donated blood at least about 75 times so far.
Oh, wonderful, wonderful.
Donating blood made me feel that donating plasma is not going to be much different. I've donated blood a few times. I've donated platelets a few times, and I know what exactly the plasmapheresis machine is and what it does and how you feel after a blood donation. I don't think it's anything different, then bleeding platelets, because you sit, hook you up to the machine, they harvest the blood, the plasma is separated, and the remaining blood cells are pushed back into you. They have a slight concern that if you can bring down your protein level. So, but anyway, lab checks it regularly before they even bleed you for the plasma. They check your blood levels and tell you, yes, you are good enough to donate. Probably if it is a little low, they'll tell you not this time, wait for another couple of weeks and come back till the body recuperates fully. And I feel it's perfectly safe.
Wonderful, wonderful, Dr. Shrikant. The audience who are watching us live today in this webinar must definitely gather immense knowledge, and they will definitely clear their thoughts and mind, and will be inspired by you today, that donating plasma is something not difficult, and donating plasma doesn't arise any sort of an infection or anything of that sort. Great. Thank you.
Thanks.
Coming to Dr. Lalit, I want to know, एक कोरोना पेशेंट के का क्या मेडिकल प्रोसेस होता है, उसका क्या प्रॉपर ट्रीटमेंट रहता है फ्रॉम द स्टार्टिंग टू द एंड?
Hello. Hello.
Hello.
Was that
Yeah, Dr. Lalit.
Lalit.
No, it was for Dr. Lalit. Okay, might be he has internet connection problem, so it's not fine. Coming to you, Kushal, what was your incubation period of COVID-19, or do you feel better as before?
So when I was, how the whole COVID-19 situation started with me and my family members was basically that I didn't have any major symptoms. I just lost my sense of smell and taste, which was something that everyone kept saying that you must get checked for COVID. And I ran a very mild temperature for one day. And having parents who are elderly at home, I wanted to just get the test done and not take any risk. So once we tested positive for COVID, my family also tested positive. Both my parents and I tested positive. A lot of people, of course, were scared. Different people have different reactions, but I wasn't devastated or scared. I was just thinking of, okay, what next, and how do we face the situation, and how do we fight this situation? And on the health front, I don't think I had any challenges or any other difficulty. It's just that I couldn't. It took me about 7 days to get my sense of smell and taste back. But I think I slept pretty much. My sleep or my eating habits were definitely the same. It was like a break, and a break from everything, and with no restrictions. Because usually when you fall sick, you have a lot of restrictions that you're not supposed to eat this, you're not supposed to have certain kind of food, or you're not supposed to basically do a lot of things. The only thing here was social distancing, staying away from people, which was different in this case. But besides that, I didn't have any other difficulty or any other problems when I had corona. But my parents developed pneumonia and were hospitalized. But by the grace of God, they were diagnosed very early. And when they went to the hospital, they got the right treatment, and they got back in 10 days. They tested negative. They came back. And touch wood, they have been doing well. And it's already been 4 months since the time they're back home, and they're safe and healthy now. So we're all in good health right now.
That's great, Kushal. And you have motivating all of them to fight against this COVID. Thank you for enlightening us.
My next question goes to Bhavesh. What were your initial symptoms like that made you go for a checkup to identify whether it's corona or not?
My initial symptoms was fever only. Like I had a temperature of 99 degrees in the night, and the next day morning they were 102 and 103. So this was my initial symptoms. So I visited doctor. The doctor said it was a viral fever, so we started medicine for the fever. Slowly I started coughing. with one or two coughing. It kept on increasing to the extent wherein I used to cough continuously for 10 minutes, wherein I was not able to breathe because of that. So these were the initial symptoms. After the fever only, after 4 days I went for the COVID test, which were again negative. It's, as in like it was strange for me, so I was sure that I didn't have COVID because in the month of June, RT-PCR test was considered as COVID negative or positive. So once my results were negative, I went ahead with the further tests. So in my blood reports, it was typhoid, and immediately after looking at my blood report, the WBC, RBC counts were pretty low. So doctor immediately suggested for a CT scan. So in CT scan, it came pneumonia. Till that time, my oxygen levels were pretty low. I was not able to breathe properly. So I think in the next day or two, I was admitted in hospital. So I was there on continuous oxygen support for 5 days and 3 days without oxygen. So my COVID was not that easy or like home quarantine.
Definitely, definitely. I understand the fact, and I believe Dr. Shrikant and Dr. Lalit, being doctors, they will agree to this fact that if we anyhow or at any moment feel feverish, we should not take it lightly, and we should definitely go out for checkups as soon as possible, so that we are making ourselves safe, and the others who are around us, the loved ones, not even loved ones, the ecosystem, the entire society, we are saving them as well from being from getting us from being saved as well. So great, 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 Bhavesh.
Dr.
I agree.
Lalit,
I agree with that.
Yeah, good evening.
yeah, good evening, Dr. Lalit. We want to know that what is the medical process of coronavirus patient?
So, I'm basically a transfusion medicine specialist. So, we deal with the donors, the collecting convalescent plasma and all. So, we are not actually related to COVID patients. As of means we don't go to ICUs. I'm a blood bank in charge. So, I can tell you the process of as to how do we select the donors, how do we do the antibody testing, the till what time will these antibodies be there. So, I can give a clarification about that.
Yeah, you can continue about the donors,
So,
that how they
okay.
donate and who can donate. Like every corona patient can donate. Yeah, there is some restrictions.
See, the collecting convalescent plasma is actually an apheresis process. It's similar to an collection apheresis collection, a single donor platelet collection. So apart from the normal donor selection criteria as to the age should be in the range of around 18 to 60 years, his hemoglobin should be in about 12.5, total protein should be about 6. Apart from that, what the thing is, in addition to this, for convalescent plasma, the donor should basically have an effective amount of antibodies. So, as such, the ideal test for detecting an antibody is basically a neutralizing test, so which is not actually not available with almost 90% of the hospitals. So there are semi-quantitative tests which we do in our lab for detecting HIV, hepatitis B. So on those machines, we run the antibody levels of the donors, and if it's above a threshold, we collect it. Now each and every blood bank will be having a different cutoff based on what machines they have. Hello.
Yeah, okay, wonderful, Dr. Lalit.
Yeah. Yeah. So as per the guidelines, like uh, uh, Mr. Bhavesh was saying that he was actually not RT-PCR positive, but the blood banks or blood centers might have tested his antibody levels, and based on that, he basically might have donated plasma because his antibodies are there. It's an indirect indication that he actually had COVID at that time when he was sick.
Yeah, but Dr. Lalit, I came to know when I went for the further investigation, as in like why
Yeah.
I'm still not
So
recovered 100% from the pneumonia, because I was still having breathing trouble after coming back from the hospital. That time
Yeah,
doctor told
actually,
me like,
what the
you
thing
must
is,
be having.
suppose if you can go back to the history, the Wuhan virus. So
Mhm.
actually, the initial cases were actually detected based on the CT finding, not on the PCR finding, isn't it? So that's what thing happened with you.
Correct,
Maybe.
correct.
Yeah.
Correct, Dr. Lalit, because these days as well, we are talking about, and since the very beginning, we know that there could be other tests as well, which can come in future for identifying the coronavirus. These days, I believe one is the PCR testing, the other one is, I believe, the antibody testing. And there is also one more test which I came to know yesterday through WHO webinar, that these three types of tests are prevalent for identifying corona in a patient. And at times when actually the PCR started, it took a little bit time. It took like several days for the report to come out, and that is, I believe, must be the reason that the second test, which is the antibody test, which took over. Maybe if we could know more about these tests in the coming days. Great. Dr. Shrikant, my next question goes to you. Do you have any idea where you caught COVID?
Oh yeah, the hospital. I don't think I have any doubt about it because that was the time when we were just coming out of the lockdown in Karnataka. I'm from Bangalore, and we were still working in the hospital, going to hospital back. We were not, the rest of the things were not fully opened out yet. We were going out to eat or theaters, and nothing like what it is today. So I'm pretty sure that I felt contacted in the hospital somewhere because whatever the hospital tries to do segregation, when you come in and out of the hospital, there is always a place where you will run into people. And I firmly believe that the one of the two things, either masking, social distancing, or sanitization, something must not have been up to the mark at that point of time by me. Otherwise everybody is safe. That way, virus is actually, if you keep taking these three things, I don't think anybody will catch corona. So I'm sure it must be from the hospital.
Sitting back at home these days, we tend to get this urge of going out for a while and have our dinner or lunch in a restaurant or in a hotel, wherein I believe this is a space wherein when you put off your mask, you are more prone to catch infection, even if you're at a restaurant or a hotel where you're eating and allowing your mask to be put off, and this is the space which actually unknowingly people are visiting these days, and definitely they are more prone in such spaces, not only in hospitals. So we should know that where all and what places, at what places we could actually get caught by this infection. Great, great.
Right, that's absolutely correct. I don't think
Coming
we are still out of the woods yet because uh, socializing is a part of our life. I mean, we're all humans, we're all social animals, and extremely difficult not to socialize. It's extremely difficult not to touch your face. And frequent sanitization is something that nobody has done so far in all our lives. Something that is new. Last 6, 8 months, people have been told, wash hands regularly, sanitize regularly, don't touch here, don't touch there, don't touch your face. So these are new things we are all still learning, and at some point of time, this will, these mechanics will fail, especially when you are outside. If you go to a restaurant, if you go to a party, if you go to any crowded place, one of these things will definitely break down. And if you do come in contact with somebody who is carrying the virus, you may catch it. So I think it makes sense to stay safe, keep yourself a little away because the risk of catching corona is very high, either for you or for your family, and especially if you have elders at home. I don't think it's fair to them that you carry home the virus because you see feel the need to socialize. Till the vaccine comes out and we have the entire country immunized, which takes a time, and the government and the WHO and the ICMR gives us the go ahead. I think everybody should practice sanitization, masking, and social distancing.
Wonderful, wonderful. As one of our audiences, MR Meghana, she's asking the same question to pose to you, Dr. Shrikant, that what are the recommendations and advice for the public you have in case of a COVID-19 outbreak again? So I think what you have said just now, it goes out for all the public as a great advice to follow and to be at home if...
Avoid crowded places. Keep your interactions to minimum. It's difficult. It's tough, especially if you have children at home. If you have an active lifestyle, if you the first diabetes person who like to socialize, it will be difficult, but discipline is always possible. It takes a little concentration and if you do anything for 3 weeks, it becomes a habit. So I think that's something that you should remember.
Great, great, great words.
Coming to you, Kushal, the infection caused permanent effect and complication on your body?
I think it's too early to say if it's caused any kind of permanent effect, but I've been monitoring my health and a couple of parameters on a regular basis. And when I say monitoring parameters, what I've been up to is regularly checking my blood pressure, regularly checking the oxygen saturation levels, so that, if there's any symptoms that I notice, anything that I notice that's not regular or not normal, I could seek immediate help. To be very honest, Corona is as new to the normal world as much as it is to the doctors. I think this is a place where doctors are equally exploring a lot of new things with the patients. So with each patient, the exposure, the kind of cases that they're dealing with, they're learning new things and they're able to help us differently, trying to understand from different experiences they've had. One of the very common things that I've heard is it has cardiac complications in the long run. So far, touchwood, I have had no issues. I've had no problems, such as a lot of people complain shortness of breath and some sort of palpitations, but I was fortunate enough to not have any of those, and my health has been pretty good. I recently donated a unit of whole blood just about 3 days ago for a liver transplant patient. So, which means that my health is in a good condition, so that I'm still able to donate.
That's wonderful, Kushal. Yeah, as you are motivated that you are pretty well and you can donate more than one time. Yeah, that is very pretty well that
Yes.
you are donating again and again for the person who is really need.
Yes. So one thing I really, I think, one thing I'd like to call out or say very specifically on this webinar is a lot of people might say that, they might see esteemed people like Dr. Shrikant or Dr. Lalit and say that, they're from the medical profession, so they don't have the fear of having to donate plasma or blood. I think it's the same across, whether it's a normal person or whether it's a doctor. The process of apheresis is very safe. And even before donating plasma, I used to be a regular platelet donor. Considering the dengue season and the malaria season in Bangalore, whenever we used to have these outbreaks, I've been regularly donating platelets. It's a very safe process. You can just sit down, relax, leave everything to the blood bank staff to deal with, and we can be saving lives. It's probably less risky or less challenging than getting a tattoo on oneself. So I'll compare it to tattooing, because when people see big needles, they're very scared as to what could happen. But it's less painful and less risky, I would say. So I will encourage everyone to donate plasma if they're eligible, because after a certain age and with certain comorbidities, even though a person has recovered from COVID, they will never be able to donate considering their comorbidities or their age groups. So every possible donor should definitely donate.
Great, great. Wonderful to know such a statements from all of you. You all have been plasma donors, and you're motivating the audience to be future plasma donors as well. Wonderful, wonderful. Bhavesh, my next question goes to you. How are services provided to corona patients different from other patients? If you could enlighten us with it.
Just have a different ward, nothing else. Everything was same. The doctor came in PPE kit. We were not able to see who the person is, but yes, his words used to motivate me
Oh.
to get well soon. He's like, Bobby, don't worry, you will
Mhm.
be fine. Don't worry, don't worry, don't worry. You're recovering well. You're recovering well. He kept on motivating me every
Mhm.
time he came and met me. His name is Dr. Swami. I never saw his face because when I went for the revisit, he was not there. So his other doctor was there who helped me with my follow
Mhm.
up cases. But yes, it's different. The motivation and the positivity is the most important
Mhm.
part to recover from this, not the
Wonderful,
medicine.
wonderful. This goes out for the entire audience who are tuned to this webinar right now, who are actually apprehensive at times. This thought that if they contract to this pandemic, then what will happen to them in isolation in the hospitals? What would be the treatment? Whether they would be whether or not there would be an indifference from the doctor's end or not. And as you have mentioned that there wasn't any difference apart from just the C1 that they were in their kits and rest. The concern and the care which was given by the doctors were rather is exactly the same which is given to a normal or any other patient, be it a pneumonia patient or a typhoid patient. So do not be scared once you contract and if you get hospitalized.
Yes.
Wonderful, wonderful,
And don't get
Bhavesh.
scared of the bills also because I feel like when I was in hospital, I feel like people were saying hospitals are overcharging and they're charging bomb. If a doctor wears a PPE suit, you have to pay for it, and the PPE suit will cost you bomb. But nothing like that happened. As in, like my bills were so. As in, that was again a big relief when you would get discharged. Were very nominal. As in, they kept on everything to the extent wherein nobody is overburdened with anything because initial stages when you go to hospitals there's nothing called as cashless because they are overburdened with the work. Even the insurance companies were overburdened with the work that they were getting. So yes, don't be scared. The hospitals are not overcharging and they're only going to charge for the services and for the medicines they are going to use.
Good to know. Good to know this information. I also had this perplexity in my mind earlier. I was baffled with the thoughts, with thoughts that what if I in future get contracted by corona and I'll be charged a hefty amount in the hospital. So I was also a bit scared. So good to know the information
Yeah, don't
from
be
your end.
scared.
Wonderful, wonderful. So this goes out for all the audience out there who is listening to us that do not scare. There isn't any sort of a hefty bill which will be mounted or be just thrown at you. It is something which is optimal. So great, great, Bhavesh.
Dr. Lalit, Dr. Lalit, we want to know the person who is already suffering from other diseases like asthma, cancer or diabetes, उनकी बॉडी पे क्या इफेक्ट होता है कोविड-19 के ट्रीटमेंट का?
Okay. So the thing is, basically, COVID is actually affecting your lungs, and the function of lung is basically to supply oxygen to other vital organs. Now, once the lungs gets damaged, it will cause multi-organ failure, like kidneys, livers, etc. will also be getting damaged. Now, patients who are actually having comorbid conditions like asthma or diabetes, hypertension, they are at higher risk when when they have COVID, because they already have a comorbidity, because of which the other vital organs are actually already affected, and this COVID will actually be, it will be very harmful for these. And that's the thing. The mortality rate in these kind of cases are quite high as compared to the normal patients who are completely fit. So if you see any renal cases, a renal failure case or an asthmatic case, and if he gets COVID, I think he will be suffering more as compared to normal patients.
Oh, I understand that. However, I was not aware of this fact that this can also be the case. Wonderful, Dr. Lalit, as you have also cleared some more doubts of all of us today. Great, great. Dr. Shrikant, I come back to you. Could you please enlighten us as to how the plasma donor is selected? Any special or any sort of procedure is followed? What is actually the process or yeah, the process of selection?
Yeah. The first thing is you should have had COVID. That is, either be treated for COVID or you had exposure to COVID, or both, either with the RT-PCR or as a HRCT, that is high resolution CT scan of the chest. We wait for 28 days because there are two types of immunoglobulin which the body produces to beat the COVID. And what we are interested is in the later immunoglobulin. So at 28 days, we presume that acute phase immunoglobulin is down, and then the immunoglobulin which is remaining in the body is the one which is going to be protective against, which is useful for a COVID patient. So when you go in for a COVID donation, your first obviously your height, weight, health is checked, and the hemoglobin levels and blood counts are done, and the antibody levels are checked. So you go in to the blood bank, give your blood, then you wait for about 45 minutes to an hour till all these reports. These reports are checked by the transfusion doctor, the transfusion specialist, who will tell you if your hemoglobin is all right, your total count is all right, your protein levels are good, and if your immunoglobulin levels are good enough to be donated to somebody else. Once this is done, then you go to the blood bank. They put a small needle into you. It's not painful. It's actually quite comfortably done. And then the blood is connected through a series of tubes and bags into what is called as an apheresis machine. This apheresis machine, I believe, is something which is like a centrifuge inside, which goes round and round, and the heavier RBCs are separated from the plasma. And this plasma is taken away separately. You can see the plasma being collected into a bag along with some amount of fluid, and about 350 ml of plasma collected every time, and along with the other fluid, it comes up under 500 ml. This is divided into two bags and given to two separate donors. All the red blood cells are pushed back into your system. The full process takes about 25 minutes or so. So as it is going, there is a monitor there which is facing you. It tells you the time that you have spent on the apheresis machine. It tells you what is the process going on, whether the blood is being drawn out of you or the blood is being pushed back inside you. And also you can see the bag which are filling up and emptying, first with the whole blood and then the PRDC, and the blood is being pushed back into you. And finally you see a bag of straw-colored plasma, which is then taken away and divided into two bags and then sent off to the appropriate donor. The entire process takes about 45 minutes. Then the blood bank officers have to wait back for about 15 minutes or so. They treat you to a nice cup of tea or juice, whichever you choose. And then once you're feeling fine, they let you. If you're not feeling comfortable, I think they will ask you to stay back some more time. I've never seen it happen with all the other donors that I've seen it also. Probably just if you're dehydrated, they wouldn't even start harvesting plasma. So it's as simple as that. And Anybody who's had COVID, I think, should go ahead and get themselves checked with an appropriate candidate to donate plasma.
Good to know information, Dr. Shrikant. We have one of the audiences. His name is Snake, which is reflecting here on the screen, and he wants to ask you: is it true that impact of 5 injections, which are given to patients at the time of 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 uh, of uh, uh, positive report that yes, they are suffering from corona, these patients are they are reacting on there are reactions shown by such patients as far as heart is concerned, and most of them are dying due to heart attack. That's what he wants to ask you, Dr. Shrikant.
If I get the question correctly, is it that the treatment which is given for corona, do they cause heart attack? Well, the
Correct.
answer is yes. The answer is no, it does not. What causes heart attack in a corona patient is the coronavirus affects the entire body. It sometimes affects the blood clotting system and makes it pro-thrombotic. It makes it more prone to having blood clots in the body. And these blood clots are the ones which are thought to be responsible for the heart attacks which we see in the younger age group of COVID patients. There are a lot of tests that doctor will do to see if they already have this tendency to have a blood clot, that is a D-dimer level. If your D-dimer levels are high, your doctor will put you on a blood thinning agent. You continue for 4 to 6 or 8 weeks. You monitor regularly with your D-dimer levels so that you don't get kind of attacks, whether heart attacks or a blood clot in your legs, which floats up to your lung and blocks your lungs and causes massive cardiac arrest. So it is not the medication as such. It is one of the sequelae of corona. This is why corona is considered to be so dangerous. Even if you are a young person, you don't have too many comorbidities. The ones with more comorbidities are more prone for this. But even if you do not have a comorbidity, people do have a sudden coronary event, which is why corona is considered to be dangerous. Unfortunately, it is preventable. Go to your doctor, he will check you. He will check your, get admitted corona, all your total count, your D-dimer levels, all that is being will be checked, and you will be given correct advice. And the treatment is fairly simple and straightforward. You can take it at home once your acute is over.
Great, great. I hope Snake's doubt is clear by now that people are actually not dying because of the infections given during the phase of their hospitalization. It's just a mere reaction of which actually causes a blood clot, and this is entirely a myth. Thank you, Dr. Shrikant, for enlightening us on this.
Yeah, coming to heart, Mr. Krishan Kumar, he's saying that would you like to, he's requesting you to help and support our blood donation and plasma donation campaigns across the country. Yeah,
Is that a
coming to
comment or is
ahead,
that a...
Mr. Kushal. Yeah, it was a recommendation.
Yes.
Yeah. As you have donated more than once or more than twice, so आपका जो एक्सपीरियंस था डोनेशन का वो सिमिलर था या हर बार आपको कुछ इश्यूज आए समथिंग क्रिएट लाइक सेकेंड टाइम आपने डोनेट किया हो तो वो कुछ डिफरेंट था या थर्ड टाइम डोनेट किया तो वो समथिंग डिफरेंट था?
Okay. So, on an honest note, I think every time I donated, I felt more confident and more motivated. My experience as far as donating was concerned, I didn't have any issues after donating. The only thing that I proactively did was drank enough fluid and water so that I didn't feel dehydrated. And that's the only thing that I did. I neither felt sick or neither had any difficulty or did not feel tired. And the only thing that I did was I did not drive for 15 to 20 minutes after the apheresis procedure. And considering that there was no difficulty, the only thing that I would say is that people do get scared to visit a hospital or a blood bank in the time of COVID. And like Dr. Shrikant rightly pointed out, that if we follow social distancing and keep our interaction to minimal and have it only when required, and also sanitize and follow all the safety precautions, there is no reason to believe we would be affected. So it's all in the mind. I would say it's a mind game as well. And the second thing is, when we understand that somebody's life could benefit from this, somebody's health could benefit from this, it definitely becomes easier. It becomes it becomes a very pleasurable feeling that you're able to help save somebody's life and make somebody's health better.
Wonderful to know this from your end. My next question goes to Bhavesh. As a plasma donor, were your queries about the donations answered? And could you just tell us something about it?
Yeah, as in I had a lot of questions with, as in like the blood bank, the head of the blood bank was always there to help me. As in like whatever queries I had the first time I donated, so I went for a outstation, as in because of my work I have to travel. So I traveled, I don't know, I drive for 4 hours and I went to work and I came back and I was feeling very weak. So next time when I went for the donation, I asked her, like, this was the thing I faced with my first donation. So she's like, when you donate, you have to keep yourself hydrated at least for 48 hours, and you should not travel. Don't do anything don't do anything which will, as in like, affect your body in terms of traveling or doing anything over exertion work. But yes, all the queries were sorted, as in like, and just to be on a safer side, she also did some protein test and other tests on my plasma just to check the strength of my plasma. And whatever queries were there, they were sorted out. There was no issues, and I kept on donating, and I went the sixth time as well.
Wonderful, wonderful. For all our audiences who are watching us live right now on the webinar, I must. It's commendable to hear people who are actually donating plasma 6 times or 7 times, and there isn't any limit to I believe go and donate plasma. This is a noble cause. As much as you can go and be a part of it, it's commendable. Wonderful, wonderful to know that if anybody from now onwards wants to become a plasma donor, his or her queries will be answered in a structured and in a proper manner, the way yours were answered. And it's really good to know information for us, for myself, for the general public who have so many confusions about going about it. Thank you so much, Bhavesh.
Yeah, Dr. Shrikant, what is the psychology of a COVID patient when they come into the hospital? What they have the mindset?
The first and the foremost thing a patient has is the apprehensive. They're very worried if they have got COVID, and they've heard so much, they have seen so much, and WhatsApp they've had so much of information, and a lot of it true, some not true. I think they're very, 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 very apprehensive. The next thing they're told is that they have to get admitted, which is a shock, because for a cough, cold, fever, or something which is mild, if they ask you to get admitted, you feel it is an overkill, and that's where concept of doctors may overcharge and for something simple. So these are all not I mean, there's genuine apprehensions. I think when the doctor speaks to them, they will know that it is not just as any other cough or cold you get a COVID, because it affects so many other systems in your body. That is why we are admitting you. There are treatments if you get tested early. There are enough and more so that early testing and early treatment keeps the symptoms mild, keeps you away from the ICU, and makes you COVID negative much earlier than waiting for longer. So my advice to everybody will be, don't worry. If you have a doubt, get tested. The government has done a good job at giving so many centers with free RT-PCR. If you can afford it, go to a private lab, or go to a government lab. Test early, because you have a very small window for which you can see the COVID. That is between day 4 to day 7. Today is it. You test today, you have another 24 or 36 hours before you get your report. Already 1.5, 2 days are gone. If you wait for even 1 day when you get a fever, that means already 3 days are gone. That means the third day, the first day, the treatment should have been started already slipped by you. Day 4 to day 7 is when all the treatment is effective, whether it is the rescue, whether it is the plasma, whether it is any supportive treatment. After that is the COVID sequelae which starts. And between day 5 to day 12 is when, at that point of time you start feeling breathless, you get very severe cough. And once you start getting very, very, very intensive care. So I advise everybody, even if you're mildly sick, it may seem like a overkill for the next 6 months, 9 months, or a year or so. Get yourself tested, because there's a good chance that with early treatment, you're not going to have very severe symptoms. So, not to get too worried about it. The hospitalized patients are always depressed because, one thing is that you never see a doctor. He's always wearing his face mask, PPE, and conversations are very they're not normal because he'll be talking to you through a mask, and sometimes if the mask, the voice doesn't come through. He may not convey to you what he actually wants to. His empathy and the sympathy may not come through. But just be the doctor has your best interest in heart, and within 95% of the time you will be fine. And the other thing about the patients who are tested COVID but mildly positive is that they feel that their quarantine is a very, very, very unnecessary thing. It is important to understand that quarantining is there to protect everybody else, because right now India is in a situation where we seem to get a lot of this COVID is under control. But if we cross the threshold, then it will become uncontrollable, and then we see all the problems through the society, and to the healthcare infrastructure not being adequate, not getting enough beds, not having enough oxygen, not having enough medical supplies. So the best thing to do is test, and test early. If you test early and if you're positive, quarantine yourself. 15 days in your life is not going to make any difference. Believe me, it doesn't make any difference. Take a holiday, sit at home, not feeling much better, go back, ask your doctor, and most of the time you will be fine. 95% of the time you will be fine. It's only the 5 to 3% who require intensive care, and we're fortunate that enough intensive care is available in our country. So I don't think it is anything to be afraid of. It is that the fear of either turning out to be positive or quarantine keeps people away from testing, and that is the biggest mistake that they can make. Test and test early. It may be an overkill in these the coming 6 to 9 months or a year till the vaccines come out, but that's the only way forward. If we want our normal life back, I think that is the only way forward.
Wonderful, wonderful, Dr. Shrikant. On this note, I would just like to elaborate it and ask you that if we want to participate in any sort of a vaccine trial going on for COVID, how can we participate? And did you do something like that, Dr. Shrikant?
No, I have not participated. No, I have not participated in any vaccine trial, and I'm fairly sure that I will be one of the candidates who will be rejected for the vaccine trial. Because once you're the antibodies, I don't think anybody is going to vaccinate me. I would be probably last on the list to get the vaccine. Once you're a COVID patient, and especially if you're a plasma donor, it means you're fairly safe against pain of COVID, and you can be quite brave in going out. But I don't think I will be a candidate for any kind of vaccination trial. But all COVID patients, I think, by default are excluded, because if you survive the COVID, I don't think you need the vaccine.
This fact that yes, as a commoner or as a public, we also can be a part of such trials.
Yes.
It actually gives us.
Yes, you can be. What you need to do is contact your local COVID hospital, speak to the person and tell him that you would like to volunteer for the trial. whenever they get the notification from either the company or the government that they're looking for volunteers, like maybe they're looking for 10,000 or 20,000 or 50,000 volunteers, they will have you on database, and they will sign you on. The first lot of volunteers would be the healthy ones. Next lot of volunteers will be the post 50 years and 60 years and above. Then come the last group, that is the people who are below the age of 50. So that is the way, to my understanding, is how the trials are going to be run. So if you are young and healthy, otherwise fine, you have not got COVID, on your local hospital, then inform them that you would be interested, because they do not know when it is, and by the time they get the vaccine, it will be too late to go around building up a database. Who is interested, I think, should go speak to your local hospital wherever you are, because there are certain criteria. If you want to volunteer for a vaccine trial, you should be available, you should be willing to come for regular medical checkup, to be willing to give the time for it. Supposing they call you today, tomorrow, day after, 1 week, 2 weeks, 1 month hence, you cannot tell them I'm traveling and on a holiday, I come now. So those are a few criteria which they will choose before they take you on as a volunteer, because it makes no sense to them to give you the vaccine and then they disappear and they're not able to check whether you have whether you responded well to the vaccine or not responded well. So whoever is willing to volunteer for the vaccine should be willing to come into the hospital for regular checks. They should be willing to answer on phone, should be willing to answer questionnaires on email. They should be willing to actively participate, and only then I think you can be a volunteer for a vaccine. Otherwise, it would be a huge waste of resources from the point of view of the company or the government if somebody takes a vaccine and gets off their radar.
Wonderful, wonderful. And I would want to nominate myself to be a volunteer for vaccine trials in the coming days. And I believe the audiences who have heard you today, they are also now motivated, inspired, and they got to know much more about how they can also volunteer from their end to be a part of this novel vaccine trial. And they would definitely do great.
Hello?
Mr. Kushal, how much time does it take to recover from symptoms like loss of taste?
Yeah, so I've had varied experiences when I spoke to different people. Personally, I regained my sense of taste and smell from about the sixth day from when I got my test results. So after that, I slowly started regaining the smell and taste, and after that, I didn't have any problem distinguishing. So when I say loss of smell and taste, right, my sense of smell was completely ruined, as in I couldn't even figure out that the garbage needed to be emptied out. That was the level of my loss of smell. When it was loss of taste, I knew that I was eating a certain kind of food, but I could not distinguish between spice, sweet, salt very well. So that was the problem. Usually, from all the people that I've spoken to who had this symptom, I've seen them recovering or getting that sense back in 5 to 7 days after either being on medication or having tested positive. That's my experience.
I agree. I lost my sense of taste, smell for about 7 days. My taste was fine, but it's like a switch on, switch off button. One day you can,
Sure.
you know what you're smelling, your coffee. Next minute you just don't know what's happening, and it's very, 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 very strange. Smell is one of the things that it's always there, and when only when you don't have it, you'll know how much you miss it. And when it came back, it was the same thing. One day I just woke up and then suddenly I used to keep a small bit of this Vicks next to me every morning when I wake up, smell it and see if I'm back. And exactly on the seventh day, it came back. So
Great.
Good to know. Good to
hello.
know. Wonderful. Good to know that that actually this is happening to people. I initially thought it is just a myth wherein people are losing a sense of smell and taste. However, with you being panelists today on this webinar, I'm getting so much so enlightened about that. Yes, definitely there are symptoms wherein you lose smell, you lose a sense of taste as well, and this is actually happening, which I used to think might be a myth or might be something which is hyped. Nevertheless, good information to know. On this note, Bhavesh, as you have donated plasma 6 times, how often can you donate? Is there any restriction, or is there any count by which it's decided that you can donate plasma for this many number of times only?
No, after 15 days, as once I donate, I can donate again after 15 days. But again, if I have to donate, they check my antibody levels. So there is a certain level, which doctor said right here, there are different levels of every hospital. Someone have something, someone have something. So if it's beyond the average level, then you can donate every time. You don't have, if once you are there at the average level, then they don't take you because your body also need an antibody to fight against.
Oh, so as you have said that every 15 days we can go and can be a plasma donor. That's what you are saying, Bhavesh. And apart from the other tests which are conducted, they will also be conducted in order to check the antibodies, the hemoglobin level, as Dr. Shrikant
Yes.
mentioned, and probably
And the
then.
other few tests as well, not only antibodies and hemoglobin, then they will do your HIV. Every test will be going for that antibody before it reach to the right person. So that antibody has to be completely safe for the patient who is going to receive.
This will definitely help our audience today to understand that there isn't any restriction as far as you are fit and you pass all the tests conducted, and every 15th day you can go and be a plasma donor. Good.
Yes, and your antibodies
Wonderful.
will definitely going to increase once you start donating, and it would be definitely constant. As in, like it's been 4 months or 5 months, I still have a good antibody levels with me even after donating 6 times. So there is no fear that you will catch again, and your antibodies level will increase if you donate. It will increase.
Wonderful,
And you,
wonderful. Yes, Bhavesh, you were saying something.
no, I just completed my statement. Sorry.
No, wonderful, wonderful. Well, we never know whether we are going to catch it again or not, because I have heard a few cases wherein I got to know that people are catching it again and again, and it was actually a myth that if you have contracted to this novel coronavirus, you cannot get it again. But actually, I have been in contact with a few individuals who actually told me that they have contracted to this disease again. So again, I believe Dr. Shrikant will also agree that there is much more to be unraveled on this mystery of COVID pandemic for all of us to know.
Yes, yeah. But considering the amount of infection that's going around, the reinfection seems to be extremely rare. Can happen, but it's extremely rare. I don't think there are too many documented cases of COVID patients catching a reinfection. Some, I guess it will take some time, some more studies, so probably another year or so to go by to see who are the people who are susceptible for a reinfection and who will not get. It will take a little more research, and time will tell us who is suitable for reinfections and who is not. But our experience with other similar viruses, that is the coronaviruses, which are typically the adenoviruses, tells us that reinfections are relatively rare.
Okay, okay.
Dr. Shrikant,
Great.
we want to know. Yeah. Dr. Shrikant, we want to know that how the person can build their immunity level to fight against the COVID.
Yeah. First thing is be happy. Happiness increases your immunity level. Be stay positive. Your immunity levels will go up. Secondly, active. Aim to spend about 45 minutes to 1 hour a day outside. When I say outside, it may be running, it may be cycling, it may be swimming, maybe even say going for a small walk. Third thing is avoid junk food. They are known to cause low immunity. And if you have any comorbidities like diabetes, blood pressure, asthma, make sure your treatment brings you to appropriate level so that will these are a few things that you can practice. Have healthy food. Healthy food is basically one fresh fruit any day, every day. Anything that you of your choice, whatever is available locally. It may be a banana, it may be an orange, it may be an apple, it may be a watermelon. Any fresh fruit is an absolute essential for to build up your immunity. You can, if you do like the taste, dry fruits are good. And physical activity that is proven beyond doubt. 45 minutes a day, 6 days a week will definitely build your immunity. Try that for about 2 weeks, and your immunity levels will definitely go up.
That's wonderful. That's wonderful. One of our audience want to know that his name is Sushant Kumar. You want to know that does immunity reduce if we donate plasma?
No, it does not.
No.
The reason is immunoglobulin are produced by the B cells. The B cells have already been stimulated by the virus, and the stimulation lasts anywhere from 1.5 months to about 6 months. Whether or not the COVID is there, it is irrespective of the level of your immunoglobulin. Once they have been stimulated, that is their job to produce the immunoglobulin. What the blood bank does is take some of this immunoglobulin and give it to a sick patient. Your B cells are still with you. Your B cells have already been stimulated. So they have their own way of responding to these anti-agent, that is the virus, and they will produce antibody levels till such time that they are programmed to do. So donating plasma will not reduce your own immunity. The second thing is the blood bank will check your protein level, which is also one of the indicators of your immunity. So when you donate your plasma, if your protein levels are low, they will tell you come back again after 2 weeks. So, and third thing is your hemoglobin. They check your hemoglobin, they check your total count, you're free of other infections, and only then will they collect your plasma. So you'll be fairly sure that the systems in place, there are well protocolized systems in place at the blood bank to make sure that you are immune enough to donate blood, and also they will collect only that much so that you don't fall sick. And also be rest assured that once you have contacted COVID and recovered from it, there is an internal mechanism in your body which is producing this immunoglobulin, and that is why we are able to donate it. If it's not producing immunoglobulin, we would not be in a position to donate it. And this process goes for, as we know, from anywhere 1.5 months to about 6 months.
That's great. That's great, Dr. Shikant. Yeah, many will, by hearing you, many will go and donate the plasma because there is no side effects, nothing. So more and more will go and donate today.
Nothing happens. And you will be checked if you're healthy enough to donate. That is the first and the foremost. You should be assured of that. If the blood bank feels you're not up to it, or if you're not fit enough to donate, they'll tell you come back some other day and donate be a week or 10 days from now. Or even if you're not if you're going to empty stomach, they were not going to donate. Pick you up as a donor. They will say go eat something and come back. They'll check your hemoglobin. They'll check the height, weight, everything. They have a set parameters which will make sure that your plasma donation is extremely safe.
Great to know,
Even
Dr.
they check their
Shrikant.
nerves. I'm so sorry.
No, that's okay, Bhavesh.
Sorry. Even the blood bank check their nerves also. That nerve should be that much healthy to take that plasma donation. If your nerve is very small, so they will not allow you to donate. because I had this as like I was there for donation. There was a donor who wanted to donate, but because of his nerve size, he was not able to donate. Because your nerve is not able to take the pressure of as like sucking and putting back with the pressure. So yes, blood bank take care of each and everything.
I agree, as Dr. Shrikant mentioned, that sedentary lifestyle is something which we need to relook upon, and be active, and we need to invest our time in exercise, physical activities, in order to remain fit and be active, and be safe with increased immunity. Just as the final question to all of you, Dr. Shrikant, Bhavesh, and Kushal, what is your message for the youth of today who think they are immune, as India is the world's youngest nation? Dr. Shrikant, with you first.
You broke off halfway. What was your question?
What is your message for the youth of today who think they are immune, as India is the world's youngest nation?
My message to the youth: make every day ordinary. Pick up something which you can make your everyday less ordinary. Today should be less ordinary than yesterday. Then your whole life will be extraordinary.
Wonderful, wonderful. Good to know. And Bhavesh, your message for the youth?
I think like the person who has COVID negative, I think like COVID positive and they're negative now, they should come ahead and donate. And I was seeing a movie yesterday, I Am Legend. So I feel, I think like after donating, I definitely feel something like that, where my blood has the a power to immune someone, as like he can be sitting back again with his family because of my plasma. It feels so good that as like people are getting back to their own life because of a plasma. So yes, people should come ahead and donate.
Wonderful. And you, Kushal?
My simple message to everybody in the country is that if you've been affected by COVID, do not get too paranoid and scared. Rather than looking at why it happened or how it occurred, let's look at a solution. And the second thing is maintain distance and maintain good hygiene practices, no matter whether you were infected once or not, because that's going to be a habit that we build. And once the habit is built, it's going to be very hard to break it, and we can save. So it's about living responsibly, not just for ourselves, but for everybody around us. Maybe everybody else doesn't have the same immunity as another person, so it's about live and let live. So let's make sure that we are safe, and we also create a safe environment for everybody around us.
Wonderful, wonderful. On this note, I would like to thank all of you here, though we lost Dr. Laladan Tore in between due to some technical reasons. Had it been the case, he would have been here with us on today's webinar. We could have got more insights about this whole discussion. You decided to go public with your story today. Continue good health. We express our sincere gratitude to all our panelists to take time out of their busy schedules to share their stories with us today. It is smart for us to be worried, but not panicky. Just follow the protocol. Stay a little bit scared. It's not the end of the world. We should take lessons from the corona survivors. In this, we thank Dr. Maria Negam, the co-founder of Prana Pan India, who helped us to successfully conduct this webinar, as all of our guests for today are from Prana Pan India. Prana Pan India is an organization which provides pan-India plasma donation support by encouraging convalescent plasma donors and systematically matching them to recipients combating the coronavirus. Thank you so much, all of you, to be a part of this discussion today.
Thank you.
You're welcome.
Thanks, everyone. Stay safe and stay healthy.
Bye.
Wonderful. And we just end with this note that Anti-Corona Task Force every day ventures out to help more people out there, and it works for humanity purposes. And we also started campaigns like A Kiran Asha Ki, and some flood relief campaigns as well in Assam and Bihar. Let us not forget the responsibility towards our brothers and sisters who have stranded in that part of India. We request you to donate as much suffrage, food supplies, and monetary assistance that you can. Visit us at anticoronataskforce.org to contribute. Please do like, share, subscribe to our channel. We will endeavor to bring the best to all of you. Pour in your suggestions if you have any. We would continue, and we would love to grow with you all. Stay safe, stay tuned, and see you in the next webinar. Namaskar, Jai Hind.